healthcare for women is not fair, and it's not just the same for everybody. So then I thought, well, I'm very lucky because I feel better. I feel the best I've felt for years because I've balanced my hormones, but lots of women can't. And I hate to tell this to you, Sanjith, but I think India is one of the worst countries. It's one of the worst countries in that hardly anyone is prescribing hormone treatments.
The medic who revolutionized hormonal care. 31 years, you just corrected me, as a GP, 10 of which solely for menopause help. Her online programs have trained 36,000 practitioners. Her Balance app has been downloaded 1.6 million times and has logged 136 million symptoms. Her website gets around 425,000 visitors every month. Her clinic has done 75,000 consultations. She has written 4 books, 3 of which have been bestsellers as per Sunday Times. Dr. Louise Newson, why have you been avoiding us all this time?
I've been a bit busy, actually.
2 years?
I know.
But seriously, we at Miror are so happy to just, I am thrilled that, after 2 years, I get to see you. I get to, first of all, get educated by you. We spent some time today with the team. For me, every day just is so much more information. And thanks for inspiring me. I consider myself as a male ally. And it's because of women like you, experts like you, someone who really feels it from the pit of our stomach, wanting to help women. You inspire me, doctor. Thank you.
Thank you. Well, it's great, the work that you're doing. And, I think it's good that men are talking and thinking differently as well, because everybody knows somebody who's having hormonal changes that are negatively affecting them.
So true, so true. In our community, we see thousands of women going through so many challenges. Women are the fulcrum of their homes, they're fulcrum of their workplaces, of society. And when they feel so not in touch with themselves, it's, we've got to help them. And thank you for doing this. You started as a GP, you're still a GP, and then you got into hormonal care for the past 10 years. What got you into it and why?
Well, it wasn't something that I was expecting to do. As a general practitioner, I'm used to treating everybody. And I've always prescribed HRT to people who obviously needed it and asked for it and wanted it. But I've also done a lot of evidence-based work. I've worked as a medical writer for many years. And for me, it's so obvious to think about hormones, because when people take hormones, they feel better, which is actually really lovely, but they also improve their future health. And it was only 10 years ago that I realized that other doctors and clinicians were not doing the same. They were more scared of hormone treatments for the wrong reasons, and they were doing their patients a disservice. So I started to do a bit more work, but also around that time, I started to experience some symptoms, and I was feeling very tired, very lethargic. I didn't have any energy. I didn't sleep very well, and I was getting some night sweats, but I thought I had lymphoma, a type of cancer. And I'd wake up at 3-4 in the morning covered in sweat. I'd get a towel and lie on it because I didn't want to wake my husband up when he was sleeping. And I said to him, I'm really embarrassed to go to the doctor. I've got night sweats, I'm tired, I'm sure I've got some cancer. And he said, I don't think so. They'll laugh at you if you go to the doctors. So I carried on. But then I got a lot of joint pain, a lot of memory problems, and a lot of irritability. But I'm not really an angry person, but I was getting very angry with my family, which is an awful thing to do. But my memory was also bad, and I thought I couldn't cope having 3 children and a busy job. And I kept looking at my patients and thinking, I can't remember you, I don't know the drug doses. I was finding it really hard to work, and I was only working 1 day a week as a GP, so I couldn't reduce my hours. I couldn't change my hours, so it would have meant giving up my profession. And then after a few months, I was getting quite angry with one of my daughters. My middle daughter, Sophie, was on her phone, and she said, Mummy, you get so cross. Maybe if you had a period, your mood would improve, because that's what happens to some other people. And then I suddenly thought, oh no, all these symptoms I'm getting are related to my perimenopause. I haven't had a period for several months, but I hadn't joined the dots. No one had sat down to me and said, this is obviously your hormones. I should have known it because I'm a hormone specialist and I was writing papers and books and articles, but somehow I didn't because my brain wasn't working enough. And then I thought, well, where do I go for treatment? Because my own GP is too scared to prescribe hormone treatments. So I had to find a specialist, I had to pay for a specialist, and I'm very fortunate because I take hormones. But that made me realize that healthcare for women is not fair, and it's not the same for everybody. So then I thought, well, I'm very lucky because I feel better. I feel the best I've felt for years because I've balanced my hormones. So it means I can look after myself, but lots of women can't. So it sort of accelerated me into this space because I saw friends of mine, relatives, dropping because they weren't feeling as well without their hormones. And I'm very active. I want to do things to make a difference. So I never realized that the problem was as bad as it was. I thought it was only a few women that might need treatment. And everywhere I look, every country I go to, it's terrible. And I hate to tell this to you, Sanjith, but I think India is one of the worst countries in the respect that it's one of the worst countries in that hardly anyone is prescribing hormone treatments. And it's also, I'm really sorry, but this is fact, one of the worst countries because you have such high incidence of heart disease, diabetes, osteoporosis in your women. And I only need to look down the street and you see women either disappearing, they're not visible, or they're suffering. And it's just wrong. There we go.
Wow. You know, this is such a perfect segue for me to tell you that's why Miror was born, and that's what me and the wonderful people in my team work tirelessly every day to solve that one problem, right? And it's to make women feel they're not alone in this journey. And last World Women's Day, we launched our Miror's HRT Center of Excellence with the sole intent of creating awareness, because women should know that they have an option. So anyway, thank you so much, because what you're saying is so true. Doctor, what I've seen when I talk to so many women is that either they're in denial of this phase, they're embarrassed, or they just face it with sheer apathy, saying that my mother got it, I will get it, my daughter will get it. What's so different? It's just a natural progression of life. What would your advice to all of them who are ignoring this, what would your advice to them be?
So I think we need to think about it very differently. And it's the same in the UK. There are some experts saying it's just a natural process, it's a transition, it's something all women go through. But let's think about other conditions we treat in medicine. You know, many years ago we didn't have painkillers for people in childbirth. Now we have them and people don't suffer. We used to die a lot younger, actually, so we didn't have years without our hormones. We didn't used to treat raised blood pressure because we didn't have the treatments, and people had a higher incidence of heart attacks and strokes. So we don't just watch people suffer. The big problem is that people think it is just about symptoms that they can endure or get through. And the hormones reduce, really important in every cell in our body. So hormones are just chemical messengers. We have dozens of them in our body, and they're made in different organs. So a lot of people would have heard of thyroxine, they would have heard of insulin. These are hormones. Adrenaline, cortisol are stress hormones. So our body's making them all the time. And as women and men, actually, when we're younger, we make progesterone, we make estrogen, we make testosterone, and they work on every cell in our body. So when we don't have them, our bodies don't function properly. So as women, we have a choice. We can think about it as just symptoms, which may or may not improve with time, or we can think about it as a long-term hormone deficiency with health risks, because without those hormones, this is just fact, our bodies do not work as well. So true. And so we are exposing ourselves to a higher risk of diseases, which sadly our mothers, our grandmothers, future generations have done. And so of course we can choose not to take hormones. Of course we can choose to never exercise. But what saddens me is as women understand more about hormone treatments, how safe they are, how effective they are, how they can improve symptoms and future health, they are still struggling to get the treatments because doctors have not been trained in the right way. And so there's a real blockage. And that's what is a real problem.
So, doctor, why is there so much fear on hormones and hormone therapy?
So it's quite political. I'm very interested in the history of medicine because it unpicks a lot. And what's very interesting is when they discovered hormones in general in the 1930s, they knew there were these chemical messengers in our body and they discovered all sorts of them. But when they discovered estrogen and progesterone, they labeled them as sex hormones, so associated with women and also fertility. And then when they discovered testosterone, the word testosterone from the testis means that it was about men, and of course that was wrong. But what happened was they wanted to commercialize them, they wanted to be able to prescribe them. So even in the 1940s and 50s, they made synthetic versions of them where they chemically altered them. And from then on, they realized that people who took these synthetic hormones that aren't actually hormones had some risks and side effects. But they forgot about how the natural hormones work in our body. But over the years, people have forgotten about the other symptoms. So when they first talked about hormone problems and menopause, they talked about flushes and sweats. And they mentioned vaginal dryness, but not very many other symptoms. Because when they did research, it's very easy to see if someone has sweats or flushes.
Exactly.
But if someone's saying to you, oh, I feel really tired, I'm low in my mood, it's harder to measure. So they forgot about all the other symptoms. And now it's become almost like it's a luxury to have hormone treatments, and women feel that they should just put up with their symptoms, which is completely wrong. And people have also thought that these hormones are only made from our ovaries and they're only there for our periods. But actually, not all our hormones are made from our ovaries. We also make them in our brain. So
Wow.
they're brain hormones too. And once we understand that and understand they work on every cell in our body, it takes the conversation away from gynecologists and thinking about how we can help our whole body, every single organ, and our brain. You know, our brain is the most important organ of our body. And we want to try and keep as healthy as possible for as long as possible.
So true.
So we need to think differently about what the lack of hormones is doing to women.